Hello, my name is Jonathan Schwartzman. I am a second-year medical student at the University of Central Florida College of Medicine, and today I'm going to present the following poster: Awake Patient Meniscectomy Using Nanotechnology, How to Transition from Traditional Arthroscopy. A bit of background before we jump into nanotechnology. In the past 2 decades, arthroscopic procedures have become increasingly popular when compared to traditional open surgeries because of their smaller incision sizes, decreased soft tissue trauma, postoperative pain, healing times, and infection rates. These benefits are enhanced with smaller arthroscopes, which further reduce the risk of cartilage and soft tissue damage. The next evolution of outpatient arthroscopic technology will increase recovery times via smaller entry apertures, lower fluid flow, and using fewer anesthetic and pain medications in the office procedure room environment. While traditional arthroscopes have a diameter between 3 and 5 millimeters, the 2 millimeter diameter nanoscope by Arthrex has demonstrated diagnostic and therapeutic efficacy in cases ranging from elbow arthroscopy to excision of unresolved Osgood-Schlatter disease. Meniscectomy is the most common arthroscopic procedure in the United States. Thus, advancements from the nanoscope and other nanotechnology may offer timely improvements on a large scale. These benefits are reinforced by using the nanoscope in an awake patient, which decreases the cost and complications of general anesthesia while allowing for a more engaging patient experience. The use of nanotechnology represents the next paradigm shift in minimally invasive arthroscopy by eliminating the need for narcotics, physical therapy, and incisions. Table 1 shows the evolution from standard arthroscopy to nanoscope arthroscopy in as little as 6 weeks. In the first week, you're using the nanoscope, but you have a full arthroscopy setup as accessory equipment should that be needed in the procedure. By the second week, or whenever the surgeon is comfortable, the full arthroscopy setup can be eliminated and the entire procedure can be done with the nanoscope. Over the next 4 to 5 weeks, the use of general anesthesia will be replaced by sedation and local anesthesia, and then awake patients with local anesthesia. Table 2 highlights some of the salient benefits in using nanoscope technology when compared to traditional arthroscopy. The first is with incisions. Because you have a 3 to 5 millimeter diameter arthroscope in traditional arthroscopy, you need to make an incision to enter. However, in nanotechnology, you only need a point of entry established using a spinal needle. With only a point of entry, this is going to increase the satisfaction that patients have for aesthetic reasons, but also removing the need for an incision decreases the risk of wound dehiscence in post-op. You can appreciate the sizes of these points of entry if you look at the right side of the poster on the intraoperative images section. On the leftmost image, you can see from the surgeon's point of view the medial and lateral portals and how small those points of entry are. The bottom 2 rows in Table 2 highlight some of the most important benefits of using nanotechnology in arthroscopic procedures, especially from the patient's point of view. Because you're replacing incisions with points of entry, and you're replacing larger diameter scopes with smaller diameter scopes, less fluid is required to be introduced into the joint, which decreases capsular expansion. This expansion of the capsule, because of fluid introduced into the joint intraoperatively in standard arthroscopy procedures, makes patients more susceptible to pain and decreased range of motion. Thus, they need narcotics and physical therapy post-op. In nanotechnology, the decreased fluid requirements lead to decreased capsular expansion, decreased pain, which eliminates the use of opioids and narcotics in favor of ibuprofen as needed, and decreases physical therapy to minimal or none. Table 3 further highlights some of the benefits and limitations of nanotechnology arthroscopy as it stands today. As we've discussed, there's an incisionless approach, in-office meniscectomy procedures, and less fluid requirements. These procedures are adept for active patients and athletes of all ages, including elderly patients with degenerative knee diseases. A few potential limitations are that the 0-degree view of the nanoscope might be difficult for surgeons to work with initially because they might not be accustomed to using a 0-degree scope. Further, a 60 cc syringe that's normally placed on top of the arthroscope, which is introducing fluid into the joint, may wobble and cause the scope to shift positions. Thus, to mitigate this risk, we recommend using a saline pressure bag not directly connected to the arthroscope as a means of introducing fluid into the joint space. One final limitation we'll discuss today is that the nanoscope might be inappropriate for patients with a high BMI and/or stiff knees. These 2 factors make it more difficult for the surgeon to properly access the joint space, especially those surgeons who are not yet familiar with using nanotechnology. On the left side of the poster, you can see the typical case steps that go into a nano-arthroscopy procedure, and on the right side, you can see an example case from a typical patient experience. Thank you very much for your time and attention.